I'm Caitlin Chittister. I'm an oncology nurse coordinator in the urology clinic that works with prostate cancer patients here downtown.
And I'm Brad Webster. I'm a urologist here at the main hospital at Roswell.
Well, thank you, everybody, for being with us today. Dr. Webster, let me start just by asking you, let's talk about the importance of this particular campaign. Is this something that men think about enough?
Probably not. It's incredibly common. It's one of the most common cancers men get. 1 in 8 guys will be diagnosed with prostate cancer in their lifetime. So everybody effectively would be connected or affected by this disease.
You hear the word cancer and automatically you think the worst. But the reality of prostate cancer is that it's curable and that if caught early, really there should be no problem.
Yeah, prostate cancer is one of those cancers that screening is so very important, because if you start screening on a yearly basis early on, it really can be caught early, and most prostate cancers can be cured.
So Dr. DeBerry, what's the conversation like with patients, people who come in to get their screening? What's your conversation with them?
Well, it really depends on the patient. Some people are going to be very anxious and very nervous, and they have a lot of hesitation about coming in to be screened. They may have a relative or someone who's had cancer of some sort, not necessarily prostate, but they've had bad results from it. And then there'll be others who are coming in and they're very anxious. They really want to learn what their status is. Mm-hmm. So it's really individualized for how a patient responds to you. That's how you have to respond to them. So we can't, one size doesn't fit all as far as how we interact with patients.
That's so nice to hear too. Now, I do want to also encourage everybody who's with us right now, if you have a question, these are the people to be asking.
So right now, it's really important to understand the significance of early detection. We're part of this Be a Pro campaign, 7 News teaming up with Roswell Park. And there are a number of ways for you to register and sign up to get that appointment, to get that screening for prostate cancer. Number 1-800-ROSWELL. Number 2, you can go to roswell.org/beapro. We've also got a QR code for you that you can scan to make sure that you are making that appointment ASAP.
Okay, let me ask you, if somebody comes in, they're going to, let's say they scan the QR code, I'm making an appointment. Can you talk me through what the appointment is like? Because I do think that people have, a little bit of anxiousness when it comes to things like that.
It's very uniform. We do this very commonly in our clinic. It's one of the most common things we see, obviously. It's very quick. It's a blood draw. Usually before you're even in the clinic, you're doing your blood draw, looking for this blood level called PSA, prostate-specific antigen, which was discovered at Roswell Park. And then it's a physical exam. It's a discussion with your family history, evaluating what your risks are. Do you have a strong family history of prostate cancer? Your ethnicity affects your risk for prostate cancer. Jewish heritage, Ashkenazi Jewish folks are at higher risk, and then your first degree relative. So it's getting a history in a sense of what your risk for prostate cancer is.
I feel like we don't do that enough with so many things.
Absolutely. But we know so much about prostate cancer that we know what to be asking. But again, it's the blood test for the PSA. It's a discussion about your risk factors, and then it's a quick physical exam. It is an exam where we're feeling the prostate, making sure there's no lumps or bumps in the prostate. But that takes all of 10 seconds to do.
10 seconds.
So yesterday I was talking about the age range, and I was explaining that, you could be 40 to 69, 40, obviously, for those people who have the risk factors that you were just mentioning, but 45 to 69 is the typical age range. So why is it at that point that you need to get that screening compared to, say, 50? Because Peter was wondering, he thought it was always 50, but now we're seeing 45. Explain that age range to me.
The guidelines changed a few years ago, and I think they just found that especially the earlier range, the ages 40, are for men with who are African American, who have Jewish descent, who have relatives with breast cancer, ovarian cancer. The 45 range started a few years ago. They just found that 5 years of extra screening really made a difference in some patients.
So here I am, the big Jew here. We got a lot to worry about, but we get it screened, we get it done, we get it handled. Again, you go to roswellpark.org. Is it roswellpark.org or roswell.org? roswellpark.org/beapro, or you call 1-800-ROSWELL. Dr. DeBerry, the reality is Black guys also have a higher risk of coming down with prostate cancer. Why is that, and why is it so important for Black men, especially, to get screened?
Well, we know that there's a higher risk in the African American population, but it's not just African Americans. It's a worldwide incidence in Black men. This problem, we don't have all the answers to. We think there's some genetic factors. There are also some environmental factors. It tends to affect Black men at an earlier age, presenting with a higher grade cancer and a more aggressive cancer. So screening is very important. Before the PSA test, most times when we would find prostate cancer, patients would have advanced disease and they couldn't be cured. Now we're able to find the cancer. We can find patients who don't need to be cured, and we can find those that do need to be cured, and that makes a big difference.
You know, this is also interesting to me because this is a completely different exam. And, you know, we were talking about this with Anita yesterday.
Right.
She was saying that I, you know, perhaps provided too much information about how this digital rectal exam actually works. But, you know, we were talking about this, and you think digital, you're thinking, okay, I need to get a scan or something.
You think a computer kind of, you know.
We're talking fingers here. It's less than a minute, as you mentioned.
10 seconds.
But it's important nonetheless.
Yeah.
Maybe a little uncomfortable because you lose your pride for a second, but it is what it is.
Yeah,
You're kind of rolling your eyes at me.
because it's a medical thing.
We do it so commonly.
Yeah.
It's like very commonplace to us. So
Means-
it's like,
Yeah.
From our perspective, the fact that we do it so commonly, it's like it's not embarrassing for us, but
No.
it really is not a big deal.
So Howard has a question too. He says, listen, I get that blood work done every 3 months. It does include a PSA. Would I need something more?
Not necessarily. It depends on your family history and
Okay.
what your risk factors are. So potentially having that discussion with your primary care doctor or a urologist would be prudent. But
You know, I thought it was kind of interesting because did I hear you mention breast cancer, that could be something that could connect with it?
yeah, like the famous BRCA mutation also
Sure.
increases risk for prostate cancer.
Wow.
So most people don't know that. So
No, I
that's
had
why
no
we're
idea.
asking those questions.
Yeah.
Interesting.
About your family history for prostate or for cancer in general, and trying to make that link.
So this is what Bob has to say. Thanks to Roswell back in 2017, I'm here today to watch this. So
Wow.
Roswell is doing great work here. And as you heard, the PSA was actually discovered here at Roswell Park. Dr. Guru, who was with me this morning at 6:30, was explaining that. And be incredibly humbling knowing that you guys are helping so many different people here at Roswell.
It's very cool. Roswell has a long history in Buffalo in cancer research, in moving forward with clinical trials and just our care for patients. And, you know, Bob, that's wonderful news. We actually have a lot of volunteers here at Roswell, and they volunteer here because they are cancer patients and they want to help other patients moving forwards.
So, Dr. DeBerry, what's your advice for people who are watching this morning? Again, you can go to roswellpark.org/beapro to be proactive about your health, or call 1-800-ROSWELL to get an appointment for the screening. It's not today, but certainly it will be in the future. It's important to take action for your health.
It's important to finally get off your seat and make an appointment. You probably have heard previous requests for people to be scanned and screened and things for prostate cancer, and you may have ignored it. If you've never been screened before, then this is the time to come forward. This is non-judgmental. Nobody's going to talk to you negatively because you've never been seen or screened before. And it's very important that you make this initial step, this initial move to come forward and start being an advocate for your own health.
I think a question that a lot of people might have too when they say, thinking, you know what, I never have been screened. Is there a cost associated with it? Or is this covered under my insurance? How would you answer that for people who maybe have never been screened before?
Absolutely. Most insurance plans cover this. It's very low cost. The physical exams, obviously, very, very low cost. But I don't think that should be much of a concern because it is relatively cheap.
And you know what? If you call and you do sign up, I think they're going to be able to talk you through that process too, and probably take a closer look for you with all that information in front.
All of this goes on your health insurance as well. Catherine says genetics can give you a higher risk, but 90% of cancer is environment, so everyone needs to be screened. Lynn says, I wish the guidelines would allow screenings earlier, starting in the early 20s. My aunt was diagnosed at 26 with breast cancer. So we mentioned the guidelines are changing constantly, but what would your recommendation be for somebody who is perhaps in that younger age group in their 20s to monitor, or what would you say to them?
Well, I think particularly for this, you know, for Lynn, you know, if she has a family history of breast cancer, you know, most she should probably get her aunt. My guess is her aunt had a genetics consult or had genetic work, and
Right,
so
that's young.
what she could work with her primary care physician and getting a genetics consult. So at least she would know if she has those genetic markers, and then she could be evaluated on a more frequent basis.
And, we were also talking about the people who are signing up, because already we're seeing people sign up, which is wonderful
Great,
news.
love that.
But people who are older than 69 don't necessarily need to be screened. Is that what I'm understanding, Dr. DeBerry?
Well, there are several factors as far as older patients are concerned. Whether or not intervention will make a difference in the course of their lifetime. But if you're over 69 and you have concerns or questions about it, call, and you may not qualify for this particular program, but we would be certainly happy to screen you and check you for prostate cancer.
Wonderful.
Great
Yeah.
news.
It's hard to ever find somebody who you're going to say no. You know what I mean?
Mhm.
Like, I think that's a really important thing. So make the call. Get on with somebody and they'll be able to answer some of those questions. Sometimes the people who join us in the morning for Second Cup, we call them cuppies. Okay. We get a lot of the same people every single day. And I wanted to bring up Marguerite's comment because sometimes they just say these funny things. And I will say they just make me laugh. Marguerite said, back to your comment about how it takes 10 seconds. She goes, boy, it'd be great if a mammogram took 10 seconds. Marguerite, I'm with you. I understand. But you know what? I think that's all the more reason to not only know as a man you should think about getting screened, but tell those men in your life, like,
Right.
how important is it for other people to be supportive of that? Like maybe my spouse, my significant other, my daughter, that's my husband. Yeah, my daughter even,
Sure. Absolutely. It's essential to have that discussion with
Yeah.
your family members that, could save their life. Again, it's a very quick blood test, quick physical exam, quick discussion with your doctor. So I don't think there's any reason not to be having these discussions.
And like we're sitting here having these easy discussions. You guys are so easy to talk to and giving great information. Like this is what it's like when you go to one of these exams.
Yeah, absolutely. Like we're not scary.
I promise. It's not scary. Yeah.
So Jeff Russo actually went through the exam. He got that blood test. We see him. And then he also got the digital rectal exam. And again, it's literally just, okay, I don't want to get too graphic because Anita yelled at me yesterday, but maybe you can, in
That's
your
my
physical doctor sense, nurse sense, walk me through what the exam actually entails.
It really is very quick. Usually it's done by a physician or a fellow or a resident, and they put on a glove, they put a little lubricant on, they stick their finger up a male's rectum because you can feel the prostate through the rectum. That's really the easiest way. They just feel around it. They can tell whether it's enlarged, whether it has some bumps on it, and then they take their finger out and there's a little diagram. They mark it on there, and then if it's concerning to them, then they'll send them for more testing. But it really is literally as fast as in and out.
Are you a mom?
I am a mom.
I knew it. Here's how I knew, because
she's got a good mom.
Thank you.
Yes. No, here's something that I'd like to bring up because not to throw our meteorologist Aaron Minkowski under the bus, but there was a little bit of confusion this morning when it came to this exam versus a colonoscopy, because I think he was thinking there's a prep to it. There's more to it. Can we talk someone like Aaron, who might be a little confused about those two tests, through the difference of the two? And then maybe also let's hit on why that's important too, because we don't want to miss that either.
They're very different tests. Like I
Yeah.
have seen that in clinic a few times where somebody gets a colonoscopy and like, oh, they didn't see any prostate cancer. Like I would not rely on a colonoscopy as a prostate cancer screening tool. So they're very different tests, even though they're the same area. But
that was the question yesterday that we had as well. Why can't we figure out if there is a risk or if the prostate is abnormal when we're doing a colonoscopy?
It's by feel. You really got to feel.
Really?
That's the whole point. Like, short of super aggressive disease, is locally invasive. That's which is rare. Very, very rare. But it's by feel. You got to feel those lumps and bumps on the prostate itself.
It's kind of like feeling a lump or a bump on a breast.
Exactly.
Okay.
Exactly.
And Diane has a question, Dr. DeBerry. Maybe you can answer this one. Why do they call it digital if it has nothing to do with the computer, with the digital screening? Digital for your finger.
Before we were having digital screens and digital computers, we had these digits.
Yes.
And that's what it comes from. So the ancient method of examination using the finger digit. And that's where the digit comes from.
Interesting.
I love this comment from Jeanette. She just says, listen, I love that you're having this discussion and teaming with Roswell. Unfortunately, we all need to be reminded about the importance of cancer screening. So yeah, we're talking not only about a prostate screening, but also we talked about a colonoscopy. Someone mentioned a mammogram. Like these are the things that, just like going to your doctor, your primary care doctor should be something that you fit into your schedule. We need to fit these into our schedule.
Well, and it's okay to have the conversation, right? Like we need to have this conversation, and it's okay. Like, thank you for breaking it down for me, like a child, you know, hearing from my mom.
I do this often.
But you know what? Like, that's the reality of this. That's how this all goes. And then Howard, of course, I love this comment too.
Oh dear.
Let's have Aaron do a live demonstration for everyone to see how easy it is
Well,
to do.
he's back at the studio, so that's not possible this morning.
Actually, John, we'll bring you in.
No, here's my question, Doctor.
No.
What are we not thinking to ask you? What if you could tell everybody who's watching today, and we've got about 100 or so people, 130 people here. We've got more people who are watching on other platforms. What are we not thinking to say, or what else might they want to keep in mind?
I think what Dr. DeBear was saying earlier, it's not too late. If you're 65, never been tested, I think it's very important to emphasize that it's never too late to start getting tested if you're in that age range, obviously. But, you know, don't feel like you dropped the ball if you're 65, never had your PSA checked. I think that's very important to drive home that point.
Diane's right. People need layman's terms to get the big medical idea of what's going on here, which is why I appreciate you breaking it down for me. Again, John's going to put a link in the comments here. It's roswellpark.org/beapro, or you can call 1-800-ROSWELL to make the appointment. And as Katie mentioned, this is not necessarily the day that you're going to get screened, but you're making the appointment for one of the care clinics on Worley Drive in Williamsville or Niagara Falls Boulevard in Niagara Falls. So you can go to one of those two places after you make that appointment, and you can get the screening that you need. And ladies, look, sign your man up. Make a mistake after, and then he'll be fine.
Yeah.
You know, like all he needs is a good meal.
You know, Dr. DeBerry, I had a question for you too, because are you at one of the satellite locations?
I'm at the Worley Drive site in Williams.
Because I'm going to tell you what I hear a lot from people when we talk about Roswell Park, or we talk about, let me be honest, any place downtown. Where do I park? I don't know where to park, but we're going to a satellite location for one of these tests. What is a satellite location like? Is it an easy in and out for people?
It's an easy place. There's no problem with parking.
There you go.
There's no stairs. There's no elevators. There's none of those types of things. It's a smaller setting. It's a more boutique or intimate setting than coming to a big institution to be seen.
Because I do think that sometimes people get nervous when it comes, even if I'm going to a show in Shays downtown, I hear from a lot of people, where do we park? Well, there you go. This is at a satellite location, so it's nice and easy. You drive up, they've got a lot right there. And then it's kind of nice to hear too, no stairs, no elevators, nothing that's going to make anything a little more difficult.
Lauren says, Ed, you're nearing 40, better get checked. Lauren, I still have a couple of years, but also just to point out, the age group is actually 45 to 69.
With prior issues,
right.
yes.
You are at average risk. So if you are, again, an African-American man, or you have Ashkenazi Jew in you, which we do, you know, important to maybe get checked at 40. But realistically, the categoric age range is 45 to 69.
Yep.
And again, maybe you can just clarify why it's important for those people to get screened.
Well, it's just important for every man ages 45, unless you have those family histories early.
Right.
Like we said, screening for prostate cancer really can be life-saving. And it's just an easy blood test. It's an easy exam. It's covered by insurance, and it really can save your life. And so I behoove everyone to talk to your brothers, your uncles, your cousins, your friends, everybody. And, you know, we have a satellite offices, everybody here at Roswell. We just want to help our patients, our community, and keep everyone safe.
I love what Howard is saying. Since I know there's one in Niagara Falls Boulevard in Niagara Falls, I might make an appointment. Please do so. Again, roswellpark.org/beapro or 1-800-ROSWELL.
I also want to bring up what Peter says too, because he's really saying how he appreciates everybody just breaking it down, speaking in English, if you will, rather than some high-tech medical term that he might not understand. So I think he appreciates that very much, as does everybody who's here.
Diane also saying, I always have to push Steve, her husband, because I notice things, and he's like, I'm fine, nothing's going on, I'm okay. And that's what I was saying this morning, right? Like, if you have a guy in your life, they're one of two people. They're either the hypochondriac and the biggest baby when it comes to getting a cold, or two, they are the people who are stubborn and won't go to the doctor.
And you're going to be shocked to hear they can be both. But I'm going to tell you from personal experience that they actually can be.
Well, and so there you go. So help them ease into this, make the appointment, and make sure that they are healthy, because if they're healthy now, it sets them up for a healthy future.
Yep. All right. We only have a few minutes left. If you have any other questions, make sure you're dropping them in. Is there anything that we missed, or any last few points you'd
Peter,
really like to drive home? We have a question here.
Quickly wondering, does the Roswell location on Park Club Lane in Williamsville do the screenings as well?
No.
Okay, so we need to go to the
Asked and
screening.
answered.
We need to go to the satellite facility, the care center on Worley Drive in Williamsville or Niagara Falls Boulevard in Niagara Falls.
Yes.
Perfect.
Or here.
Or the main Roswell Park campus. Okay, great. So again, roswellpark.org/beapro or 1-800-ROSWELL-PETER.
All right, we're going to go down the line and we're going to get some last minute thoughts because I want to just hit home why, if people are sitting here and they're watching this and they've listened, what do they need to do, takeaways, or what would you like them to know?
The first step is to have the discussion. That's the most important thing, and get the ball going. And then once you start, after you've taken the first step, by just even thinking about it. So once you've thought about it, make the appointment and do the simple exam and test. So
Final thoughts. I feel like Jerry Springer.
Our urology teams at Roswell are all just as easy as this, easygoing conversations. And like Dr. DeBerry says, everybody comes with all different levels of anxiety. We get it. We understand it. We're here to make this as easy as possible so that you'll say after that first time, wow, that really wasn't that bad. I'll keep doing this every year.
Is it an annual exam or is it kind of a one and done thing?
It's annual.
Okay. Dr. DeBerry?
I think the most important thing is to understand that you don't have to have symptoms or problems to be concerned about this.
Oh.
It's just like you don't wait to check your oil until you hear the engine clunking. You check it periodically to make sure it's fine. And that keeps your car running fine. And we need to check our prostates with this examination to make sure it's fine and to keep ourselves healthy.
And out of the hospital and avoid the ambulance ride.
You know
right?
what? That makes me think that I do have a question now, of course. Like here we are with only a couple minutes left and I'm coming up with one. But you're saying, yes, okay, just like an oil change or checking the oil of a car. But let's say maybe I did have symptoms. What symptom might I potentially be looking out for or feeling?
Sure. So it's highly variable.
Okay.
Usually if you're having symptoms, it's more aggressive or more advanced disease. But the vast majority of men don't have any symptoms, like Dr. DeBerry is saying. But if you were to have symptoms, bone pain could be one, blood in the urine,
Okay.
difficulties with stools. But
So
most men don't have symptoms.
it just makes me think, if most men don't have symptoms, let's get that done now. And before any of these more severe things should possibly set in.
But the reality is it's common. It's 1 in 8 and it's curable. So that's the benefit of early detection and getting that screening. Again, for men 45 to 69, now is the time to sign up to make that appointment for that screening, whether it's your first one or your 22nd. Make that appointment.
All right. Howard's saying this was a great topic for our show today. And
Yeah.
Howard, we're going to expect you to make an appointment because you said you were going to think about doing it. So Ed, one more time for everybody who wants to do that.
roswellpark.org/beapro or 1-800-ROSWELL. And again, now is the time. You're not coming to the appointment today. You're just making the appointment for a future date. Here's the QR code that you can scan with your cell phone as well. And that'll take you right to Roswell's website where you can make that appointment. Peter says, instead of saying, Jerry, the couples with their fists
dear.
bumping going, Edward.
That is not what we need.
And
Peter,
I
but
love
thank
it.
you. Yes.
Listen, thank you all for being with us.
Thank you.
Really informative, really super important, and hopefully we can save lives here by doing something like
Yeah,
this.
absolutely. I think so. I think people are hearing things that they may not have heard before. And that's what's so important about
Much for being with us on a Tuesday.
Thank you so much, everyone. We appreciate it.
Big round of applause for all of our medical professionals here. They save lives
Yes.
here at Roswell, and they're doing great work. So thanks again.
Yeah.
And thank you for being with us. We'll see you tomorrow.
Bye, guys. Have a great day.